Hey guys, Adam with Behm Muscle Joint Clinic. We got Katie with us today for our Stretch Saturday video, and over the next couple of weeks we're going to try to switch our Stretch Saturday video from stretches to something called foam rolling. So a lot of you are probably common with it. Foam rolling is a type of self-myofascial release technique. So unlike stretching where you're trying to just lengthen the muscle, foam rolling is a great way to kind of inhibit tone or get tone and tonicity and break up scar tissue and adhesions out of the muscle. But like stretching, it's not an overnight fix, so you're going to have to stick with it for a little bit. But we'll just foam rolling. You got a ton of different foam rollers. You got longer ones, you got smaller, more travel size foam rollers. You'll probably see them at the gym a lot. But this first one that we're going to do is for hip external rotators. So the muscle is on the back side of your hip. This would be a great foam rolling technique to do for someone that has lower back pain, sciatica, tight hips, someone that maybe does CrossFit or lifting of any sort, like a ton of deadlifts, ton of back squats, front squats, anything that's real hip dominant, runners. This would be a great one. To start off, we'll have Katie kind of go, she'll work her right side. So you'll want your right leg ankle over the left knee, and then she's just going to sit into that foam roller. And she's just working like a 2 to 3 inch area, and she's going to want to do this several times a day. So it's going to feel almost like a hurt so good feeling. You'll feel some knots, some adhesions. If you kind of pinpoint those, just kind of hang out on them a little bit and try to get them to kind of melt away. So nice, slow, and controlled. You don't want to really go fast back and forth, because then you're defeating the purpose of what we're trying to do. We're trying to get compression with kind of elongation of that muscle. So it is definitely a hurt so good feeling, but this is a great one to do for the hip external rotator. So you'll feel it on the back side of your hip, and just do this a couple times.